When voters are asked to list their top issues, healthcare invariably breaks the top three. This time around, the party's offerings range from boosting the Canada Health Transfer to major new pharma and dental care plans. With us to assess the various proposals, we welcome Quam McKenzie, CEO of the Wellesley Institute and Director of Health Equity at CAMH, the Centre for Addiction and Mental Health. Dr. Tara Kieran, family physician and associate professor in the Department of Family and Community Medicine at the University of Toronto. Dr. Brett Belchetz, emergency room physician and a senior fellow at the Fraser Institute. Mary Viktorovich, professor at York University's School of Health Policy and Management. And André Picard, health reporter and columnist for the Globe and Mail, and if I say, for my money, the best at what he does in the whole country. That's just my opinion. And I'm going to put you on the hot seat first, André, because according to an Ipsos poll that came out a little earlier this year, 21% of Ontarians rate healthcare as the top issue that federal parties should be considering in this election campaign. Half the people polled said it's in their top three. And yet, I think it's fair to say it has not dominated this election cycle in the way that those polls suggest maybe people want to hear about. Why not?
I think there's two major reasons. One is that there's kind of violent agreement among the parties on the large issues. So everybody loves Medicare. No one wants to, touch with that. Everybody agrees on health transfers, 3%. So there's not a lot they disagree with. And the second part, where they do disagree, they're very reluctant to wade in because healthcare is kind of the third rail in Canada. It's something that can lose you votes, but it never gains you votes. So best to keep away from it. We saw even in the leaders' debates, there was not a section on healthcare. You didn't hear the parties complaining about that. They didn't want to touch that with a 10-foot pole.
Tara, why do you think it hasn't been touched on as much as maybe the public would like it to be?
It's a good question. I think there are probably some aspects that are very complex to tackle. And I think explaining complex topics and complex strategies isn't really easily done in an election. So when we think about pharmacare and the specifics of what might make it happen or how you actually might be able to get everybody a family doctor, those things are hard to do. And I think it's difficult to actually communicate how you're going to do something.
Quam, I was interested to see in the Toronto Star last week that you had a piece in there saying you're one of the few doctors who did not think healthcare needed to be part of the official leaders' debate. How come?
Well, I work at the Wellesley Institute, which is interested in improving health and health equity. But we do that by thinking about the social determinants of health. And actually, at the leaders' debate, they were talking about health all the time without talking about healthcare. So if you talk about climate change, well, we know worldwide that's going to be 250,000 extra deaths a year, which is due to climate change. So if you start talking about climate change, you're talking about health. If you're talking about Indigenous issues and you're looking at the difference in life expectancy for Indigenous people compared to others, you end up talking about health, not health care, but health. And so I'm much more interested in the social determinants of health rather than talking just about healthcare, rather than building a system that pays for people to be ill. I want to see whether they can build systems that keep people well and allow people to thrive. So I want them to talk about social policy because social policy is health policy.
Gotcha. Mary, let me try this with you. I have read my Constitution very carefully, and I know that healthcare is a provincial responsibility. It's the biggest item in any provincial budget, and yet there is a role for the federal government. Can you help us understand this sort of pas de deux between the feds and the provinces? Who gets to decide what, who funds what, et cetera?
Certainly. Well, healthcare certainly is in the realm of provincial jurisdiction, but the federal government has had a steering role. We could refer to that as meta-governance. So through very early on, it was established through some of the acts, such as the Medical Care Act that paid 50% of the costs of provinces' expenditures on medical care. So 50-50 matching funds provided that incentive to create the universal healthcare system that we have. But over time, the federal government has shifted to block funding, and its contribution has been reduced at some points quite low, and then,
We should just clarify, when you say block funding, you don't mean block as in put up an obstacle in front of, you just mean Big chunks.
A chunk, rather than matching provinces' contributions. At one point, the federal government decided it would just transfer over a lump of sums, and the provinces basically had to adhere to the conditions in the legislation, most recently in the Canada Health Act, which sets out 5 terms. But the Canada Health Act is basically a financing statute for healthcare. So if provinces meet these 5 conditions, then they're entitled to these transfer funds from the federal government. And that's created the incentive for our universal healthcare system.
Brad, are you content to see the federal government play the role in establishing, what did you call it, like
A meta-governance role.
meta-governance role, a sort of overarching role in our healthcare system? Are you content to have them play that role?
I think there's a very big difference between content and what would I think is the optimal situation, or what would I think is a practical change to make. I think it's very, very difficult, unfortunately, to change the structure of healthcare in our country. What you're seeing with the Canada Health Act, what you're seeing with the Constitution, in order to change the way that we fund healthcare, in order for us to change the way in terms of what is the role of the provincial versus the federal government, this would require constitutional change, most likely, and also agreement from all of the provinces. So very, very difficult to make that happen. That being said, is this the optimal way for us to provide healthcare in our country? I would say it wouldn't be my preferred method. If you look at our country versus many other countries in the developed world, we're a country of 35 million people, yet we provide healthcare across 13 different jurisdictions, so 10 provinces, 3 territories. It becomes very, very difficult to administer things like physician licensing, standards, regulations, et cetera. There's different privacy legislation across every single province. All of this becomes very much a barrier to actually providing care at any kind of scale. And so, when we look at other countries, in the EU, look at the UK, France, et cetera, these are much larger countries than us. And for the most part, healthcare is administered across one federal level body.
Let me pick up on that, because, Andre, we have certainly heard, to the extent that healthcare has been discussed in this campaign, a lot of talk about pharmacare. And the main parties are sort of tripping over each other to say who can introduce a better pharmacare program. However, hearkening back to the discussion we just had here, implementing pharmacare is a provincial responsibility. So can a federal party really promise to bring in a new pharmacare plan across the country?
Well, it brings us to a fundamental question, which we've all touched upon in glancing blows, is what is the role of the federal government in health? And the role is twofold. One is to transfer money, so funding, and the other one, I think, is to provide guidance with that money. They can use it as leverage. So we've got Medicare because the federal government intervened and said, here's money, and here are some conditions: no user fees, universal access. So they can do that. They can buy change with money. And that's what the federal government can do with pharmacare. And we've seen the parties argue about how much money they would provide. But then you get lost in the nitty-gritty of what exactly do you mean by pharmacare. But, the NDP and the Greens have both made massive promises of spending. Now, Steve, very well that the less chance a party has of getting into power, the more grandiose their promises. The Liberals and the Conservatives, who are fighting to win, have made very modest promises. The Liberals said $6 billion to kickstart over 4 years, but that also includes other things. And the Conservatives have essentially said it's a provincial responsibility. So I think if you look at all the promises, there's been a lot of talk, but I don't think anything will really change, sadly.
Do you think, Brett, that there are pitfalls associated with bringing in a national pharmacare program?
I think there's a lot of pitfalls. First of all, I think what we're looking at is a program that is addressing maybe not the most pressing issue that we face in Canada today in healthcare. So if you look at access to prescription medications, and if you look at the amount of people that are struggling with access in Canada, typically this ranges, depending on the study that you look at, from about 10 to 25% of the population. So right now, in some provinces, we have very good programs that help those populations. In other provinces, maybe not as good. But when we look at what is the solution, I believe that the solution is not to over-legislate. It's not to provide pharmaceutical coverage for everybody, even those who are well covered right now, who have no difficulty accessing. I think we have to really focus on providing care for those people that actually are struggling with access right now.
That's the Conservative platform.
Yeah, let's not tear apart the part of the system that actually works. The other part of the issue that I'd like to talk about is what we've seen in other countries where pharmacare has been implemented. So I do believe universal pharmacare in one form or another is a good idea, but it has to be done correctly. So if we look at, for instance, some of the examples in other countries where the amount of prescription medications that are available has gone down drastically, where physicians regularly say they are not able to prescribe the medications they prefer to prescribe any longer because they're no longer covered by the government, where private insurance is no longer available as an option. So for those who require an expensive medication that the government doesn't cover, they have no option to get that medication. So there are a lot of pitfalls that we have to be very cautious about. The whole other side of the question is, where's the money going to come from? We're barely able to fund our existing system of physician care. I can tell you, I can see the cracks in the seams of healthcare just in my hospital where I work, where we can barely treat the patients that are coming in the door as it is. I've seen the estimates for pharmacare ranging as high as $15 billion a year. Where is that money going to come from?
I think it's quite important
Quinn,
just to remember, I do think that it's true to say that anything done badly is bad. Right, and the most likely thing is that a bunch of professionals getting together to do things will do it well. And you'd look at places like the UK where there's a pharmacare strategy which is better. You could even look at New Zealand where they're paying less for each drug than we do here in Canada. One of the reasons for a national pharmacare strategy is because we waste huge amounts of money on expensive drugs that don't need to be that expensive. So I think it's important to do it. But I think we need to be able to, for me, I'm interested also to think of what that means, and specifically what that means for mental health. A lot of common mental disorders are treated better by psychotherapy than drugs. And if you start going down the line of thinking, we're going to do a national pharmacare strategy, is this another sort of stigmatization of mental health? You get drugs, we don't get the therapy. Would there or should there be a national psychotherapy strategy if there's going to be a national pharmacare strategy? And I think we need to think through what's important. I do think, drugs are the third biggest or second or third biggest expenditure in health. And so we need to do something.
Physician salaries,
and drugs, yeah. And so we do need, that's 60% between the three of them. So we do need to think about being cost efficient on that. But I also think we need to think of what that means if we're saying drugs are important and other things are less important.
Tara.
Yes, Steve. So as you mentioned, I think Canadians have a lot of pride in our Medicare system, and I think many of them want to see it strengthened. And so to me, that includes pharmacare, it includes psychotherapy or better mental health care. It also includes dental and home care. Gaps that we know are existing in our current system. I want to go back to pharmacare specifically, like we were talking about. When we look at all developed countries across the world, we know that have a universal health insurance system like we do. We're actually the only one that doesn't have pharmacare included in it. There have been actually a lot of peer-reviewed studies, so studies in good medical journals, that have talked about the stress that Canadians feel as a result of drug costs. So I think Brett mentioned, 10 to 25% often aren't able to take their medications as prescribed. One striking statistics to me is 1 million Canadians every year go without things like food, heating, other daily necessities because of their payments to drugs. One of my colleagues actually just did a study that showed that he randomly assigned people in a practice to be able to get free medication or not. And he measured a whole bunch of patient outcomes, patient-reported outcomes. And people, without a doubt, had important improvement in their ability to make ends meet when they had the free access to medications. The last point, though, that I want to make is this idea of whether we can afford it. And there have been actually studies done that have also showed the total cost of what pharmacare would look like. And actually that if we look at a total cost picture, we as a society would actually save. So that means the federal government, through taxes and through federal spending, would be spending more than it is now. But if we think about the contributions we make to our private plans through our employers and elsewhere, we actually save. And one of the reasons we save is because nationally, we can try and work with our drug companies to get better prices. So we know that compared to other countries, we're paying too much for the medications we have right now. And the idea is that if we work together, can we actually lower those prices?
Well, this, of course, is a great debate, particularly between you two, is if we need If we need to make sure everybody gets covered, do we bring in a new national pharmacare plan that the public is going to pay for, or do we just try to fill the gaps of those who really need it the most right now? The Ontario government, in its wisdom, decided to cancel the previous pharmacare program that the Liberal government had brought in, and they've gone to a gap filling. But I've got to be careful here. I'm looking at the clock, and I want to make sure we don't let the clock get away from us, because we do want to put the platforms under a bit of a microscope here. So Sheldon, let's bring up the Liberals' health priorities. The first of 4 that we'll look at here today. The Grits say that they want to ensure every Canadian has access to a family doctor or primary health care team. They want to set national standards for access to mental health services so Canadians can get the support they need quickly when they need it the most. They do want to implement a version of pharmacare. They want to continue to improve home care and palliative care availability, and they want to work toward equal treatment in health care for women and Indigenous peoples. I would just sort of like to get a very quick summation from all of you as to what you like, what you think's missing. Andre, start us off.
Well, motherhood and apple pie, nothing you can disagree with, and they haven't put the money where their mouth is. It's the short version.
Well, I think there's detail missing. For example, pharmacare that would need to be negotiated with the provinces, and how long, what are their timelines for that? What level of funding would each level of government need to contribute? Would there be a copay? So there's a lot of questions around there. I think greater access to mental health care and setting standards around that is very important. But again, there's not a lot of detail. And, access to psychotherapy could be very important, and that's really been missing. And just the wait lists, for mental health care can be up to a year for accessing and accessing care, and in the between, patients can actually deteriorate in terms of conditions and, lead to exacerbation of their conditions and higher costs for the system, and lead to other things like trans-institutionalization, which means folks can get institutionalized within the incarcerated, with the legal system and so on. So there's a whole array of domino effects when we don't support the people who need mental health supports.
Gwen, your view of the platform?
I think it's fine, but motherhood, as you say, and apple pie, and I'm interested in less of the apple pie because I quite like the idea of people eating more healthily. And I like the idea of people actually thinking, well, okay, let's think of health in all policies. Let's think of a food strategy with teeth. Let's think about an exercise strategy that has teeth. Let's think about pollution and how that leads to improvements in mental health, in health and mental health. Let's think about supporting people with a minimum wage and how that leads to decreased stress and pressure. I think that healthcare is fine, and all of these are really important things, but I'd really like that leadership bit on health from the feds to be much more about how we create healthy societies.
I'm going to nudge everybody along here because we got 3 more to cover. What's missing from this list that you'd like to have seen?
I think there's a lot of detail missing. I think there's a big difference between having an objective and a plan. So I see a lot of objectives here. I don't see a lot of plans. I would love to see the government tell us how they're going to do this. They talk about improving access to, for instance, family doctors. How will they do this? I think every government has tried to make this happen. I've seen almost no plan that has actually succeeded in making this happen. So why will this be any different? And I think this overall ignores the crushing problems that we have with access to care across our country. If you look at our performance in terms of healthcare systems versus every other system in the developed world, we are worst in terms of access to primary care. We're worst in terms of access to specialist care, longest wait times in the emergency room. These are the crushing issues that every single Canadian faces when they get sick. And I don't see a lot in any of this that actually will address these, which are top of mind, I think, for most Canadians.
Tari, your view of what's missing?
So I echo some of the comments. I'd love to see some more detail, but I actually do like the fact that it's they're tackling pharmacare, home care, mental health care, things that we know need strengthening. They haven't put in dental care in there or talked about dental care, and that's another area that does need strengthening. I do want to also point out that I think the Liberals have actually something in their platform around opioids, which we know is a huge health issue and probably is not being talked enough about in this election. And I think it's important as we talk about this, to Kwam's point, that we also talk about party social policies that will impact health. And so I know that the Liberals and some other parties as well have some good policies, for example, around trying to impact poverty, which we know is one of the most prominent social determinants of health. And so the Liberals talk about their impact from the Canada Child Benefit and how that has actually lifted hundreds of thousands of people, including 300,000 children, out of poverty. What is the impact of that on health? It's huge. So I think when we're thinking about their health platform, we should make sure that we're broad enough that we're including some of those social policy pieces.
Okay, let's do number 2 now, Sheldon, if we can. The Conservatives' health care priorities. Here's what they've got on their list. They want to invest more in palliative care. They want to improve access to medications. They want to develop a national autism strategy. That's interesting. First time ever for the Conservative Party on that. They want to purchase more MRI and CT machines to reduce wait times for medical imaging tests and maintain mental health and home care funding. Okay, Andre, again, we're going to go to you first here. What do you see there you like? What do you see is missing?
Again, a lot of vagueness, but a lot of good, you can't argue with their priorities. There's good things there. I think the autism strategy is actually a good one. Something that's overdue. You have to give credit to Senator Jim Munson. He's been pushing for this for many years, so I think that's important.
And Mike Lake, the MP,
and
who has an
Mike Lake as
autistic
well.
son.
Yeah.
Yeah.
But I think it's consistent with their philosophy as well. There's nothing really there about funding or anything else. So it's consistent with this notion that provinces are going to do this and we're going to be there and maybe shovel some money to them. But again, as everyone says, on everyone's platforms, especially the Liberals and Conservatives, a lack of detail.
Would you like to see a more robust pharmacare option from the Conservatives?
It would be helpful. I mean, they've sort of discussed covering gaps as opposed to a system-wide overhaul like the Liberals are proposing. But, the details there are missing. So, yes, it would be nice.
Kwam, how about generally speaking as a platform?
I think they could be more robust on the mental health side. I'm not sure about more CT and MRI scans. Most scans are negative anyway, and so there's a question about whether we're doing too many of them. I'm interested with the autism strategy and interested as to why an autism strategy when there are so many other things as well. But as you say, there's been some political pressure. I like the increased access to palliative care, especially since we're in a time where people are all talking about expanding medical assistance in dying, and you'd think that expanding palliative care would be useful at that time.
Just take a second. Tell us what that would look like on the ground. Increases in palliative care. What would that look like on the ground?
I have no idea what they're thinking about. I mean, I can say that I had a dear friend, who died in the UK and who died in her 50s from cancer. And there was a nurse coming to the home. There was psychological support for her and her family. All of the drugs and everything she needed, even down to the wheelchair, was given by the National Health Service. And when the time came, she was in a hospital bed or a palliative care bed in a hospital, surrounded by friends and family and dying.
So that's what it looks like.
That's what it looks like, the home care, the nursing care, the psychological care, the support to the families. And here, if you tried to do that yourself, you would be significantly out of pocket.
For sure.
And therefore, you'd be making choices.
Tara, what's missing from that list of Conservative priorities?
So, I mean, I would say that in general, when I looked at the party platforms on healthcare, the Conservative one I thought was one of the thinnest. So they just didn't have a lot in it. And I was a bit disappointed to see, things like maintaining mental health and home care versus strengthening it. So we know from many Canadians that those are two areas that we want to see more services. And to previous points, the federal government has an opportunity to set a standard around what that should look like across provinces. We just recently finished talking to patients and caregivers who've just transitioned from hospital to home in Ontario, and we asked them what was their number one improvement priority. How could we make their care better? And it was actually better access to home care. They didn't have enough home care to meet their need. And I think for me that helped to open up my eyes around this really big public funding gap. And so can the national government actually set some standards and say, well, these are the standards for what should actually be covered in home care across the nation. So I would have liked to see more details on that. And I absolutely agree with Kwam that CTs and MRIs, that's not where we're going to get our money's worth. We can spend money on there, but I doubt we'll see any kind of morbidity or mortality impact.
That's politically sexy, though. People want them.
Unfortunately, usually it drives just overuse as opposed to judicious use.
Got it. Brett, your view on that Tory platform?
I think it's very much a status quo platform, which overall would be a little bit disappointing. I think being the opposition party that is trying to establish itself potentially as an agent of change and potentially as an agent of improvement, I think there are a lot of missed opportunities here to potentially put forward what they would do differently, to put forward how they might improve upon what's been there before. There are some interesting ideas. I think this idea of potentially improving access to palliative care, again, the details are missing, but I think that is a huge need across Canada. One of the things that I would say is missing from all of these platforms is the deficiency in long-term care across the entire country. When we look at why are all of our hospitals full, it's typically not because we're over full in the emergency room or have too many acute cases coming in. It's because there's nowhere to discharge patients to. And I haven't seen any party talk about how do we fix our deficiency of long-term care beds across the country.
Gotcha. Okay, on to the NDP. Sheldon, if you would, the next graphic. Here's what's top of mind for the New Democrats. Universal pharmacare that covers everybody. Dental care for low-income Canadians. Better access to home care and long-term care, apropos of what we were just discussing. Mental health and addictions support. And better access to healthy food for kids through a national school nutrition program, apropos of what Quam was talking about a moment ago. Okay, Andre, your views.
Well, the NDP definitely has the most detailed, the most ambitious platform. They've costed it out, so you have to give them credit for all that. They have a lot they would like to do. Will they, do they have a chance of forming government to do it becomes another question.
Well, they have a chance to hold the balance of power.
Yep, but can you force people, the majority party or the minority party to do all that? What people don't like, I guess the downside of this is it costs a lot of money, right? So can we afford it? But to their credit, again, they say we're going to tax wealthier people, we're going to tax corporations. So I like that it's straightforward, it's honest. Is it doable? We'll see.
They've costed it out, but they are depending on taxing the rich to a point where they think they will realize revenues that won't be there because rich people hire people to make sure they don't have to pay those revenues. So does this sit on a house of cards is the question.
Well, possibly, but a lot of things from all the parties sit on a house of cards.
Well, that is true as well. Okay. Quam, your view on this platform?
Well, I quite like the platform. I think it's one of the stronger platforms. I do think that we have to not just think about cost, but we have to think of value. I mean, $51 billion a year is the cost of mental health to our economy. So it costs a lot.
In lost productivity.
In lost productivity, not just in healthcare and lost productivity. So, I mean, there's an opportunity for realising some gains that way. I think we also have to start thinking about what we want as a society, and if we want a better society, if we want to deal with the 4,000 suicides a year, 4,000 opioid deaths a year, really we have to think of what we're going to do differently. And if it takes federal leadership to do that, then that's what it takes. So it's a stronger platform than all of the others. And of course, we get to the thing where they've looked at the apple pie, not just the motherhood. So we're happy about that. But is it enough? Probably not enough to make the change we want, but it's in the right direction.
Brett, what do you see?
It's an interesting platform in that I think there is a little bit more boldness here than we've seen from the other parties. If you look at the way healthcare is provided across other countries in the developed world, typically we see three components. We see universal healthcare, we see some form of pharmaceutical coverage, and we see some form of dental coverage. And it's interesting that the NDP is the only party that picked up on the dental coverage issue as well.
Only for low-income people.
But even to any extent at all, none of the other parties have even touched upon this. And when I work in the emergency room, one of the tragedies I see is that we have universal health care, except for in your mouth. And that's not universal whatsoever. And the amount of terrible health consequences you can have if you have no access to health care for that part of your body is not inconsequential. This is a substantial issue. So I'm grateful to see somebody bringing this to the debate. Again, this is probably a set of promises that is too expensive. There is no clear way that we're going to fund all of these. But I am grateful that this is being brought up. I think some of the devil will be in the details. So again, if we look at how dental coverage is provided in other countries, it's typically with copays. It's not universal with zero copay. We would have to think about bringing this in maybe in a different way from how we've brought about our universal physician coverage. But I'm interested to have this debate and think about this a little bit more.
Mary, what do you see?
Well, what I like about the NDP platform is what's outside of the health realm. So, for example, increasing minimum wage, the largest expansion in supportive housing, those kinds of things, as Kwame and Tara have suggested, will impact health a lot more than, for example, more MRI and CT scanners. So I think I like that wholesomeness, that broad approach that will have an impact on health, that all the evidence is showing.
This is basically upstream versus downstream approaches.
Absolutely.
Gotcha. Okay, Tara, your view.
I agree with my fellow panelists. I think that this platform is the most ambitious vision and the most comprehensive in terms of, and the most detailed probably out of the ones out there. I love that it has home care, pharma care, mental health care, and dental care all in it. They also have something about opioids. They have lots around the social determinants. So I think all of that is positive. I agree that it is a costly platform, and the devil is in the details around how some of this would be actually implemented. But at least they put that vision forward, and I think it's an exciting vision. And I have to say, as a family doctor, when I see that vision, I feel that if that was in place, it would actually make it so much easier for me to do my job to help support people to have better health.
Does anybody, Andre, understand what entails a national school nutrition program run by the federal government? This is traditionally something that provinces or even municipalities or school boards get into, but not the feds.
Yeah, I think it's a question we talked about. It's about leadership. It's about setting standards. It's about a little bit of money to maybe make sure kids go to school without empty bellies. We know that a lot of kids in Canada go to school unfed. Most other developed countries feed children at school, so the role of the federal government could be to push that notion ahead and to provide some money to encourage provinces to do more.
Okay, one more here. Let's get the Greens into this. The Greens' healthcare priorities, of course, I don't think we need to put it on the list here. Their attack on climate change would be the most significant thing they would intend to do to improve the health of the population. But let's also put in some of the more mundane ingredients here. There is a pharmacare program in the Green Platform. There is dental care for low-income Canadians in the Green Platform. There is a national mental health and suicide prevention strategy. There is improving health for Indigenous peoples, and, which we might spend a little bit of time on this one, a tax on sugary drinks. A tax on sugary drinks. Okay, Tara, as a doc, what do you think of that idea, putting a tax on sugary drinks?
So we know, though, that taxes impact behavior. And so I think it's a societal question in terms of our values and whether we want to impact behavior through using that form. But when we think about alcohol and cigarettes, when we increase the price on those, we know that use goes down. Similarly, I think there's evidence that if you increase the price on beverages, sugary beverages, use goes down, and we know obesity is an issue. Now, that I think is sort of something that is probably easy for us as a federal government to say, oh, it's concrete, we can do this. There are lots of causes for obesity that are beyond sugary
Just
drinks.
drinking too much pop.
And
right.
I think those are complex and
Okay,
are
I'm
harder
going
to
to stop
summarize.
you there to make sure we get everybody in.
Yeah.
Quam on this one?
Sugary drinks?
Yeah.
There's a sugar tax in the UK. And the reason for that is because taxes do make a difference. I think we've got a diabetes crisis, which is could blight a generation, and we have to be thinking big. Now, whether it should just be sugary drinks or whether it should be high carb meals in other ways, maybe. But we've got to start somewhere. And if they went too far, everybody would say, that's too extreme. So they're thinking of starting somewhere. It makes some sense.
Brad?
I think it's a great idea. I don't think anybody would argue that sugary drinks are healthy. I think that when we look at all of the options that are available in terms of trying to enforce our public health policy objectives, what we've seen in history is that nothing is more effective than taxation. So one of the most effective levers to reduce cigarette smoking in our country, in other countries, has been excessive taxation. And if we want to make people make the right choices, the best thing we can do is make it cheaper for them to make the right choice.
I just wonder, though, Mary, I mean, you're into health policy. If the sugary drink people come to us and say, what are you picking on us for? What about the candy bars? They're just as bad as, as the syrup that we put in the pop. What's the argument there?
Well, I think they do have a point. And, potentially we do have to look more broadly and look at nutrients, not just calories and carbohydrates, but look more broadly. Are we getting the nutrients we need, not just, reducing the carbs.
Andre, you want a word on the Greens platform? And you can focus on the sugary drink aspect if you like.
Well, I think the sugary drinks is sort of catchy, but not that important. I think it's actually a provincial, sales tax is provincial. I don't think they could do it. I think the really most important thing in the Green platform is not on the list, is they're saying that they would legalize all drugs. I think that's the boldest proposal that's been put forward by any party. And it's one that we know could be very, very impactful. And it speaks to the opioids epidemic, which we've all mentioned in passing is not getting near enough attention. So I think they have some good ideas there, but sugary drinks is the least of them.
Did they say legalize or decriminalize?
Well, I think they've wavered on that. They've gone back and forth, and then there was at some point Elizabeth May said she would do it temporarily and then withdraw it, and then she withdrew that comment. So it's not clear exactly what they would do, but I think if they would get the other parties to debate that, I think it would serve us all well.
We've got about a minute to go here, and can I just get you to follow up on that a bit, Andre? Would it provide a positive impact on the healthcare of Canadians to either legalize or decriminalize all drugs?
Oh, I think there's no question it would. We have examples from Portugal, for example, and we know, we've legalized all kinds of things. Alcohol, it's much better. Prohibition never works, as I guess the bottom line. And I think it would benefit us to focus on getting people healthy, providing social programs, as Kwame has said many times, rather than, putting them in jail for having drugs. So we waste a lot of money persecuting people who have an illness.
Tara, you want 20 seconds on that?
I think that, I was glad to see that three parties had a platform on opioids, which we know is one of the defining issues of our time from a public health perspective. 4,000 Canadians die every year from opioids. And I think we should be talking more about it. I think perhaps we're not talking about it because it's still surrounded by stigma, and perhaps this isn't something that's perceived by the media and others as not being something of interest to the average Canadian. But I think we should be talking about it, and it was interesting to see. I think the NDPs talked about decriminalization. The Green Party, I thought it was decriminalization, but and then the Liberal Party, not decriminalization, but actually trying to lessen the criminal consequences for people who are first-time offenders, et cetera. So, and they all actually have other. Those three parties also have other aspects that relate to trying to support the opioid crisis, which I think people should find out about, because I think it's an important election issue.
I want to thank all of you for coming on to TVO tonight and putting the party platforms through the cruncher, and we're grateful for your time tonight here on TVO. Thanks, everybody.
Thank you.
The Agenda with Steve Paikin is brought to you by the Chartered Professional Accountants of Ontario. CPA Ontario is a regulator, an educator, a thought leader, and an advocate. We protect the public. We advance our profession. We guide our CPAs. We are CPA Ontario. And by viewers like you. Thank you.